join us here. Kimberly is rapidly becoming one of the rock stars of paediatric interventional oncology in her own right, I think. This is the second time that we have shared a platform together. Kimberly joined me for a similar interview like this at ECIO last year in Spain, and it's a great pleasure to have you back here with us again today. Welcome.
Thank you for inviting me to speak with you again.
It's a pleasure. We're going to run through just briefly Kimberly's backstory here, because and that isn't the focus of why we're here, but her backstory is incredible, and we'll put a little bit of what she has to say into focus for you all. So Kimberly was first diagnosed with cancer when she was 13 months old. This is her in December 1998. She had a bladder-based rhabdomyosarcoma and underwent multiple surgeries, chemotherapy and radiotherapy for that. And what's really important, based I think coming out of the last two talks that we've heard and will inform a lot of what we're talking about today, was what is called in oncology long-term late effects. So you can be cured of your cancer, but the treatment that you have on the way is really quite toxic for your body, especially for a small child, radiation and chemotherapy particularly. And perhaps that's our selling point for interventional oncology, is we can give much higher doses of drugs or radiotherapy, but in a more targeted way, so that there's less systemic effect on the rest of the child's growing body. So that our aim is that going forwards with IO, there's much less late effects later on. So Kimberly's had late effects on her kidneys, on her ovaries and on her heart, and skeletal effects and delayed growth and puberty. Her second diagnosis, completely unrelated to the first, was when she was 18. She was diagnosed with squamous cell carcinoma of her tongue, which had spread to nodes in her neck. She underwent laser excision surgery to remove the posterior third of her tongue. She had a left neck dissection and 33 sessions of head and neck radiotherapy. And that led to more long-term late effects of dry mouth, difficulties with salivary function. She needed rehab for upper body mobility and has had intermittent hearing issues in her left ear. At the age of 22, she was diagnosed with another new primary squamous cell carcinoma on the dorsum, the surface of her tongue, further excision surgery, a select to remove part of the top of her tongue, and a selected right-sided neck dissection with further late effects, including some that affected her vocal cords. And at that point, in the biopsy, in the sample, the tissue sample, they found an incidental finding of thyroid cancer in some of the lymph nodes in her neck. So that was her fourth diagnosis, papillary thyroid cancer at the age of 24. She underwent a total thyroidectomy and the third central neck dissection with further long-term late effects. So now she has had to have thyroid replacement and all of the things that come with that as well. And then very recently, actually, while we were planning for this talk, in January of this year, Kimberly was diagnosed with her fifth primary tumour, another squamous cell carcinoma of the back of her tongue, and has undergone treatment for that. So she has had further surgery for that and has made a remarkable recovery, actually. You can see there, that's a picture of her in the hospital. So only a few months ago, was unable to eat solid food with her mum Claire, who's here today, had to learn how to cope with the tube feeds and everything to get Kimberly home, and she's been working really hard with a speech therapist to get back to what we would all think was normal speech for Kimberly, but she's a bit of a perfectionist, so I would say that you're still working on that a bit, I think, wouldn't you?
Yeah, I'd say it's peaked and recovered now, and you wouldn't notice my speech, but I think the slight sounds wouldn't quite compare to how I would say them before.
Yeah, okay. As I say, Kimberly's a bit of a rock star in promoting conversations around cancer in children and young people. This is her Instagram account here. She's really active on social media, and she has spoken and advocated with and for the CCLG, the Children and Young People's Cancer Association, King's College Hospital, and the Swallows, which is the head and neck cancer group as well. She has organised and run and led 2 evening gala performances, each of which have raised £10,000. The last one was last weekend. all organised on her own. It's quite incredible. This is Kimberly at the first gala on the left and at her recent gala last weekend on the right. And we will talk a little bit at the end about her fundraising as well. So Kimberly, after that whirlwind tour through some of the parts of your life, let's get down to some questions. When we spoke last year, you actually hadn't seen much of interventional radiology, had you, before your treatments in the last year, but things have changed with your health a little bit in the last 12 months since we last met, and you've now had, I've got a list here, you had a PIC before, but you now, because of the late effects on Kimberly's kidneys, she started dialysis treatment. She's in end-stage renal failure. So dialysis treatment in August last year.
Yeah.
You've had a perm cath. You've got a fistula, so you've had fistuloplasties. You've been in and out of IR actually. Tell us a little bit about that.
It was all a brand new experience. I had no previous experience of anything to do with dialysis or no pre-education on what it would involve really, which I think again was something that was missed leading up to going into treatment. So when we unexpectedly got told what was about to happen, you don't have any choice in that because that is now your life treatment. So for the line procedure, it was probably one of my first few times being in one of those environments and having to be awake because all my cancer surgery she put to sleep. So that was quite overwhelming and daunting to have to be poked and poked while you're awake, and obviously you are numbed and they say you feel pressure, but when you're the one getting things pulled into your chest and everything, it's quite, it is a traumatic experience. I think it's how the staff around you interact with you and explain things that can improve that, and I'd say my experience having my line put into my chest was a fairly positive one. They taught me through everything, they told me what I was going to expect. I asked, I find something I cope with is listening to music, so I had an earphone in, they allowed me to have that. And yeah, they were just very understanding from my perspective, which was nice because in an adult situation as well, you feel like you can just be a bit dismissed as that, but as a young person it's really important to understand what we need.
Yeah, absolutely. You said that you found, I remember when we talked a while ago, you said that you found the IR room quite intimidating the first time and that it actually made you remember your radiotherapy sessions.
Yeah, it's a big white room and it's all the big machinery, and like I say, being awake, my instant memory was a reflection of reminders from that.
Which weren't good memories.
No, like I say, that was being back on post-trauma, which to be fair I had completely forgot about until being put in that environment.
Really? Yeah, okay, that's really interesting. You said that some of the things that helped was they talked to you during the procedures, they told you how many, there's only 5 minutes left, things like that you found quite helpful?
Yeah, because like with anything, I feel like it's all down to mindset, and you could find that some patients would hyperventilate, panic attacks, whereas I try and understand that the best way to get through it is just literally be in that moment and cope as best as you can. So I think that communication both ways really helped with that.
Yeah. You said after your fistuloplasty they showed you the balloon or another balloon, so that, because you're always very curious, aren't you?
Yes, I like to know what's going on, and it's my body, so I like to have a bit of understanding of what's happening as well. And when you get told you have a balloon in your arm, my vision is that, oh, there's going to be a balloon put up my arm, but obviously I got shown what it was after I'd been happy on gas and air, and it really helped me to understand what was happening, and not as daunting as what I imagined it would be.
Yeah. You said, actually I remember you saying, I was shown lots of respect by the team.
Yeah, because again, it's your body, you're put in a very vulnerable position, you're in a gown, you're on a metal table, which again took me back to treatment, and you're relying on them to do whatever they need to do to you, and again, them explaining what they're going to do, and saying like, if you need to take a break, if you need anything, just like let us know. We're led as much by me as much as they were doing the procedure.
Yeah. And they gave you some choices, or you felt as though they gave you some choices before beforehand, I think, for your line insertion about you had quite firm ideas about where you wanted a line to be or not be, or...
Yeah, so for the line, I had the femoral one started because that was the instant one they needed to do because I was a bit of an unexpected case to be admitted for dialysis, and then after that the chest line did get put in. But I think it was when I had a heart catheter test that they, again, my first one of them I had was through femoral access, but then the second time they were discussing it, I said I prefer not for it to be done in a neck because of all the neck surgeries. So
Yeah.
that was just more helpful for me to share my worries as well.
Yeah, yeah, absolutely. You said you hated your perm cath.
Yeah, it wasn't fun. Well, I think for anyone it depends. It is your access to treatment and it's what's saving your life. And in the end, when it did get taken out, I did get emotional about it because yeah, I actually thanked it alive because it's kept me alive. But to have something here dangling out, limiting what you can wear, you can't shower, it changes your life in a way because it's your quality of life. And again, that was the choice around having the fistula or the peritoneal dialysis, because if I'd have gone with that as an access, you're having to change how you look after yourself, and I was very fixed on what I had to change due to that line being in me.
Yeah, yeah, okay. One of the things we also wanted to touch on, and it was nice that it came up in Fernando's talk too, is that a lot of people, I think, in the audience worry about talking to children and young people and their families as well about their health and how you... What does a good clinic consultation look like? What should we be trying to do more of?
I think with anything, it's all about the patient-centred approach. So given whatever age they are, it depends what direct conversation you have with either the patient or parent, but you've got to ask and understand what their pre-existing understanding is of their condition, what they know, what they might be expecting to be told or found out, and slowly go through things. Don't just drop a load of information or medical terms on them, or, you know, you've got to find an understanding of how much they can intake as well, because at the same time we're processing the information, we're thinking of questions, but at the same time when you ask, do you have any questions, you almost go blank. So it's also helpful to have a bit of a breather to be able to think about things properly and then come back to the whole discussion.
Yeah, yeah. You talked about that, checking in with you halfway through. Have we talked enough for today? Or and that was interesting. We saw that in Fernando's talk too.
Yeah, yeah. I think it's got to be a bit of a holistic approach to things because it's a lot of information to take in, but you need to be able to process it as well.
Yeah. I remember you telling me that when you had your first appointment with the cardiac team and you didn't know that your heart disease was that bad, that you said that you knew how the conversation was going to go just by their expressions from the waiting room, right?
Yeah, so my condition is managed by medication, and I've never, since I've been 14, been told anything to do with any surgery intervention, but we knew something was going to be discussed and brought up, but my consultant walked through the waiting room, said hello, went into the echo suite, walked back out, and then someone else went with him, and like, well, we know this is going to go, and it's quite serious, and as soon as you walk in the room, you can tell by the tone as to what kind of discussions are being brought up, and it's a bit, it makes you more nervous because you're already worrying and thinking what is going to be said.
Yeah, yeah, for sure. So also then Kimberly had an interesting perspective for dialysis too. So part of it is the preconceptions that people have about your maturity, your age and your maturity. Kimberly's 27, but often people assume you're younger than that.
Yeah, which is fair to say because I don't look my age, and I think the presumptions and what I found a bit hard dealing with it all was nurses would come up to me whilst I'm literally fresh to dialysis, sat on the machine trying to absorb and get used to this new normal, and then they're asking my age or why am I on dialysis, or I'll be fine, I'll have a transplant, but I'm not eligible and it's quite unlikely I'll be uneligible for a transplant because of the cancer history. And they're hard discussions to have, but because they didn't know about my previous background, it was kind of that thing of I wish the staff would have taken the time to have thought, if I'm going to ask questions, should I really have looked at the notes first and seen her age, and you know, I am older than I seem, and I think a lot of that was like lost as well. I was talked to as a child sometimes because it presumed my age and that it was all new to me, and again it was kind of some cases when I was going in like overloaded with fluid, it was kind of being told, oh no, this is normal, but I was trying to say, no, this, I know my body, this is too much, and again, it was just all a lot of under-communicated stuff, and they didn't know how to discuss things properly with me.
And then I think you had the opposite experience, maybe when you had your second diagnosis at 18, you would have had your mum with you all the time, you often still do now, but then talking to your mum a lot rather than to you, because that was more in a paediatric setting, so it swings both ways, right?
Yeah, so like I was saying before, you've got to understand the development stage of the patient, and I was very naive 18-year-old, and even though I had childhood cancer, this was my first experience of cancer, because I can't remember anything else. I'm used to the hospital environment, used to blood tests, all the procedures, but getting told such intense news and what you have to face was a new language to me, and it had to be that joint discussion between myself and my parent, because again, like, my mum's experienced it in her own way being a caregiver, and like, I think the consultant and the team all the time have to be aware about what they're discussing and who to and what's most appropriate.
Yeah, absolutely. And so that was something else I just wanted to touch on, was that your mum's been through all of this with you, right? And there's always a family in the background in some way. You've got a sister as well who's 7 years younger than you?
Yeah, she's nearly 20.
So you said that pretty much all she's known is you having treatments, is that right?
Yeah,
she's
so
kind
she
of grown up
was
with it.
really young when I was on radiotherapy, and when I was admitted on the TIA ward, I think one night, because my mum would be able to stay over with me, I think did get permission, she did stay one night as well, but again, for someone so young and seeing that all the stuff been go through that, they don't know what they're seeing, they're not sure how to process it, and it impacts them. I know she deals with things in her own way, and a lot of the attention can seem like it's on me because of my health, but again, I think like anything, dealing with a patient's family, they've got to consider the impact on everyone.
Yeah, absolutely. And I know that's an extra mental load for you, thinking about the stress on your mum, her having to learn new skills, looking after you, taking time off work, accompanying you for your dialysis 3 times a week now.
Yeah, well, that's the thing, dialysis is what I call my part-time job now, because again, I can't get employed, I'm not employed because of, well, it always has been that situation because of my health, but that's the thing, treatment of any kind, it affects your personal life, but also your family's, because like you said, my mum spent a lot of time with me, and she still does, and that impacts everything you do in your everyday life.
Yeah, for sure. You've got these things on the stage to tell us a little about, and actually, before we come to that, I'm just going to show this. This is the QR code, this is the 3 charities that Kimberly supports, and if anyone felt like making a donation, no pressure, but we said that we would put this up to thank her in some way. But tell us a little bit about this Beads of Courage in the middle here, Kimberly.
So the Beads of Courage are what is stretched along the front of the stage. So they are a programme and a charity that are there to support children, not just going through oncology treatments, but there's like heart conditions, burns, transplants, everything. And basically you get a bead per procedure or something you endure. So this is from my second diagnosis, which was my first tongue cancer. And what you can see is 678 beads that I collected in only 6 months. So what you might presume at the start would maybe be my whole health journey, it's actually only 6 months.
Can we get a couple of volunteers up on the stage to help us show these beads up? Friends crossing people around. Raj and Sabrina, yeah, great. Oh, John's coming. We might actually need 3, there's a lot of beads. Do you want to grab the end? So this was 6 months of your treatment?
Yeah, so it starts with my name, and here is the star bead, which represents surgery, the pink bead represents anaesthetic, blue beads represent clinic visits, black are blood tests, yellow is a night in hospital, and somewhere maybe in the middle, just there, there's a big heart bead, and that represents my end of treatment. And from that point all the way to the end is only 3 weeks. But straight after treatment I was admitted to hospital with an infection, and between each yellow bead would be a whole day in hospital. So you can see as it gets near the end, the beads get closer together as I got less medication, less blood tests, less palliative visits, which we were discussing. I had like palliative care coming into the room. And along here, so from this point after surgery, there's 33 special beads, and they're the radiotherapy beads, and they're actually done in the dark. I just think they're really important because this was my coping mechanism during treatment, and there are charities that aren't very well known, and that's why I like raising money and awareness for them, because it not only helps me, but again, at the time they didn't have a sibling program, but they do have a sibling program now where siblings can get beads as well, but you know, unfortunately, in bad situations, say where the child may pass, at least the family's still got these to represent the strength that the child went through, and obviously it's a visual story of what they can look back on as well. So that now I can say this is what I went through and this is my story, and I can talk about what happened by literally looking at the beads and what they represent.
Kimberly, you're brilliant. Thank you so much. Does anyone have any questions for Kimberly? Thank you, everybody. Thanks. Any questions? John?
I'll take a minute. First of all, my name's John. I'm an interventional radiologist. I work in London. What a remarkable young lady you are, and I admire your bravery, and thank you for taking the time and effort to educate us, because we all want to get better at our job, so thank you for that. I was really interested in your point around how we should speak to you and the way that you'd like to be addressed, and something that I personally struggle with the secondary school age children perhaps. The younger ones it's fine, because then you definitely speak to the parent. But then, if you were to come and see me for your first procedure, and I'm thinking, well, there's tons of notes here, I want to try and get a feel for what to do in the room, and you mentioned the cardiologist, you knew something was up. So, what can you give me some advice on what would be an appropriate way to set the right tone to find out what you know in a non-patronising way, so that I can then build on that place from where you've set me up from?
I've not really been in that situation, but if I was to imagine myself in that way and having that discussion, I would say you almost want to interact with them as a person first. So, like what I was saying at dialysis, it was always this question over my health and, oh, why are you here? But actually, I really appreciated someone saying to me, what do you like doing? What, you know, you're breaking that boundary and relaxing them a little bit. So it just might be of, okay, how are you doing today? Or, so like, what do you like doing? Anything like that. Just like maybe 1 or 2 questions first, and then just say, so I'm here, this is my job, I'm a doctor, and then you're having a 2-way conversation, and then you can say, so I just want to know from you what's your understanding, and you could break the conversation in slowly that way, and then go off their response and just work out how much they could take in from that.
That's super helpful, thank you.
There's a question from Graham at the end, at the back, sorry.
So, again, thank you very much for sharing. I think one thing that I've seen for children who are moving into adult services is that having been through a paediatric service, there's an expectation that every intervention, everything you have done, is with the care of an anaesthetist. You go into an intervention and then you hit adult services, and there's that transition where 90% of my interventions in adults are on patients who are awake, maybe more. And how have you found that transition from children's to adult services, where you say you've had your line awake, struggling with that that transition with some patients where they, you know, do something that I view as an adult intervention radiologist as a very simple and straightforward thing. Yes, well, let's just go and get this done under local anaesthetic and immediate resistance, and you end up sort of rescheduling services. What can we do to help young adults get through a potentially mildly traumatic intervention awake? How can we ease that transition?
I'd say from the patient's perspective, that again is something new to us. So even if you've been through all the procedures, like you say, you've probably been asleep before, and like what I was explaining, I've been asleep from a surgery. So even for what was, and I did learn, like what you were saying, it is a minimal invasive procedure, but because we don't know that and we don't know what to expect, in my mind, like I was saying with the balloon, I was thinking something was going to be blown up inside my arm, I was going to feel a lot of pain, whereas actually experiencing it was completely opposite. But when you've got the patient there who doesn't know what to expect, I'd say just having that conversation to start with, like what are they expecting, and then you can reply to them and let them know what it actually is, and again just try and calm their worries, because each patient will probably be different. Some like will be probably very panicky about things, like might be extremely scared, or some might go in with a bit more of an open mind like I might, but again, like I'm still anxious about having something done and being poked and prodded. So I would say it literally always comes down to communication and just trying to understand the way the patient's thinking and empathise and be compassionate with that, because this is in the most respectful way your everyday job, and you know what you're doing and what to expect and how the risks may be. But again, like when we're signing consent forms and you're going through everything that could go wrong, even if it's 1 in 1,000, I know for me, with my series of unfortunate events in history, it's one of the things where I think, oh well, I could be that 1 in 1,000. So it's just trying to meet in the middle and always understand where the patient feels with things.
And I think you said that you looked up some of your procedures on YouTube beforehand, so I guess there's people of your age, I'm making myself sound really old now, but will find your information from other places. So you might come to a consultation or a procedure with a bit more background knowledge than we might expect you to have.
Oh, absolutely, and that's the thing, resources are all on the internet, social media, Google, everything. When I was going for a fistula, I was like, well, what's a fistula? And look it up on Google Images and got aneurysms, and I'm sat there thinking, oh my goodness, don't want that, like that's horrible. But end of the day, that's a different patient, that's someone else's body. So yeah, each patient, like I say, you have to be centred on that individual.
Kimberly, thank you so much, an absolute pleasure to have you with us. Kimberly might be around at the lunch break as well if anyone has any other questions or wants to just come and have a chat with you.
Yeah.
I'll bring these down to you later.
Thank you. Yeah.
We're going